a very good evening to all of you. I'm Sayukta from All About Skin Well-Being, and I'm sure all of you must be doing really good. Today, we are going to talk about fungal infection, fungal skin, nail, or scalp-related infection, and for that, we have with our skin expert, Dr. Arthipriya, joining us live from Chennai. She is MBBS, MD, DVL, dermatologist, and cosmetologist, and she is currently practicing at Salon Pharmacy. She is also the assistant professor at Stanley Medical College. A very warm welcome to you, Dr. Arthipriya.
Hi, thank you. Good evening, all.
Doctor, before we start, first of all, we would like to understand, we always say preventive measures works. Are there any way we can prevent having fungal infection? Because this is the time we get fungal infections quite common.
Yeah, we can prevent fungal infections. The thing is, it is more common when when you sweat more, when the humidity is more, and when your personal hygiene is poor. You have more chances of getting fungal infection. And even cross infections are also very common. When a family member of yours is infected, there are high chances for you to get infected. So, to prevent from acquiring that infection, you need to take care of your personal hygiene and take bath twice daily, wear cotton clothes. When we have some lifestyle modifications, we can prevent fungal infections.
Fair enough, doctor. Doctor, a very common practice we see in our society is to go for over-the-counter topical applications. It's quite
Yeah.
common, especially with skin infections. In case of fungal infection, does it make the condition even more worse? Over-the-counter medication can make the fungal infection even worse.
Yeah,
What's
it
your
will.
opinion on that?
Yeah, exactly. The thing is, we have to treat fungal infections is very easy, but it is complicated by these OTC medications because when they acquire medications from pharmacy, they give a cocktail of medications, not only antifungals, but it is mixed with some steroid creams, antibiotics, some cocktail. So it tends to worsen the condition and makes it difficult for us to treat. And even the patient will suffer more because it requires longer duration of treatment.
Okay. Doctor, when a patient comes to you, how do you diagnose? Just by physical investigation, or there are tests that you normally recommend?
Physical findings is more than enough, but as you said, when it is complicated by OTC medications, over-the-counter medications, the normal morphology of the skin infection tends to change. It changes from its classical form to unusual abnormal forms. In that case, we need to confirm the infection by some fungal scraping, which is a very mild procedure where you scrape the skin to isolate the fungus and viewing it under KOH and microscope.
Okay.
But most
And what are
commonly,
the
we
treat?
can diagnose it clinically.
Okay. And doctor, what are the treatment options available for fungal infections?
So the treatment options starts with moisturizers because moisturizer helps in reducing the itching in the skin and topical antifungals. Apart from topical antifungals, when the extent of the lesion is more, if the patient's immunity is compromised, the patient is on any other medication, or the patient is working in humid conditions and is not able to control her sweat or take care of the humid conditions, then we have to go for systemic antifungals, that is tablets, and it is supplemented with soaps and shampoos, so to cure the disease more easily and more fast.
Okay. Doctor, we hear a lot of fungal infection recurrence cases. Why it occurs again and again?
Yeah, as I said, a humid condition makes it worse and difficult to control. One thing is that. And the other thing is patient tend to discontinue the treatment once the symptoms go off. Like the fungal infection is that they will have severe itching. Once we start the treatment, the itching will be controlled within a week. But for the fungal organism to go off, they need to take treatment for at least 6 weeks to 8 weeks. What happens is once the itching goes off, patient thinks that it's treated and they discontinue the treatment. So after a week or so, it tends to come back. That is the problem, one thing. Another is with OTC medication, the recurrence is common. So it's better to opt to consult a dermatologist first.
Right. Doctor, in case of pregnancy or in case a lactating woman gets fungal infection, then what is the line of treatment? What are the things to take care of?
In pregnant women, depending upon the extent of lesion, we advise only topical antifungals if it's very limited. If it's very extensive and the patient is very uncomfortable, we have systemic antifungal options which can be safely taken during pregnancy, throughout the pregnancy, all the 3 trimesters of pregnancy. So it is not a problem.
Okay. Doctor, normally how much time it takes to heal or to recover, or what is the duration of the treatment for skin-related fungal infections?
So we normally advise once we start systemic antifungals, we normally advise for 6 weeks. And depending upon the working environment of the patient and their compliance with lifestyle modification, it can extend up to 3 months, maximum 3 months. If they follow it properly, it will cure within 6 weeks.
Okay. And doctor, if we talk about the nail fungal infection, who all are at risk of having nail fungal infection, and what is the treatment options, etc.
For nail fungal infections, it is common in people who do physical labor, like people who work in hotels or who are constantly exposed to wet environment, wash the vessels regularly, or while cooking. Those people are prone to get nail fungal infection, and it is also common when they have fungal infections all over the body because they scratch with their nails. No, when they scratch with their nails, the nail also tend to get infected. And when you go to treatment option, we have nail lacquer. We call it as an antifungal is available like a nail polish where you apply it over your nails. And it also requires some 3 months to 6 months of treatment along with your systemic antifungals.
Okay, doctor. And if you could shed some light over scalp-related fungal infection, how that happens, and how much time it takes
Sorry,
to scalp fungal
the line
infection.
is breaking off. Can I get the question again?
Sure, doctor. I'm talking about scalp fungal infection of scalp.
Yeah. Yeah, scalp fungal infections is common in pediatric age group, that is school-going children. More common in them than in adults because it is common in schools where the kids sit together, play together, and it tends to spread easily from one person to another person. And even, but the presentation will differ from skin infection. They will present like a furuncle or folliculitis or just a pustule or only scratching over the head. So even that can be treated with antifungal shampoo and systemic antifungals once diagnosed promptly.
And how much time it takes to heal?
Same 6 to 8 weeks if taken
Oh,
proper treatment.
right. If there is a member in a family who is infected, what are the things that the other members should always keep in mind or take care of so that it
Yeah.
doesn't spread to them?
Yeah, that is important. When a family member is infected, you should ensure that he or she has separate soap, towel, and her clothes are kept separately. Her clothes are washed separately because when you wash your all of your clothes together, even in that thing, it can spread from a person to person. And one more thing you have to take care of is you should clean your bedspreads frequently, pillowcases frequently, and do wet mopping on the floor frequently, like twice a week at least. And when you sit on a sofa or bed, you should take care that they have a separate spot so that some other person is not sitting on that spot and they tend to get the infection again. So that is what.
Doctor, before we sum up the whole session, any take home message on fungal infection for our viewers?
Yeah, I'd like to say a few points because we see a lot of OTC complicated patients here. When you get a itching over skin, it is preferred to consult dermatologist first because whatever happens in your skin, if you apply a topical medication, it tends to complicate it and makes it difficult for us to diagnose as well as treat. It will be a burden for you and for us as well. In case of symptoms and also as economic burden because you have to spend for medications, right? And please stick to the advice your dermatologist says so that you get cleared of the condition completely. And if you follow it strictly, then it will clear in 6 to 8 weeks. Otherwise, it will take years together when you discontinue on and off and take treatment only while you get itchy. Yeah.
Right. So follow the preventive measures, take care of yourself, and still, in case you get fungal infection, please go and consult a qualified dermatologist. Don't fall for over the counter medication, etc. And follow the prescription, follow what the doctor have asked you to do. Thank you so very much, Dr. Arthipriya, for your valuable time and making this whole session so informative. Thank you for joining us.
Thank you. Thank you so much for this opportunity.
Thank you, Doctor. And viewers, thank you for your participation. For more information and updates on skin health and care, stay connected on our FB page, all about skin well being. We are also available on YouTube, Twitter, and Instagram. Thank you and have a great evening ahead.